Hello everyone, my name is Marilyn Milton and I will be presenting my slides on the integrating methods of quality improvement. My case study takes place in an OBGYN clinic. MA is a 30-year-old female gravida 1 para 0 who is visiting the clinic for her 28-week appointment and who has now experienced an adverse event. MA has had an uneventful healthy pregnancy with no complications. The provider has spoken to MA regarding the Tdap vaccine. Patient has accepted and is now ready for the vaccine and discharge. The clinic is short-staffed and very busy, so the nurse delegates the vaccine administration and discharge to the CMA. The CMA needs medication to be inspected and cleared by a licensed nurse in order to administer. Medication is cleared without being pulled or inspected by the nurse. Patient is given an HPV vaccine and discharged. Once the CMA sits down, she realizes she administered the wrong medication. Once the error is identified, the provider is notified, who then contacts and informs the patient. Patient is closely monitored during the remainder of her pregnancy, and patient goes on to deliver a healthy baby with no evidence of an adverse reaction in the mother or infant. A near miss are events or errors that occur in the process of providing medical care, which are detected and corrected before a patient is harmed. An adverse event, which is what MA experienced, is an undesirable experience associated with the use of a medical product in a patient, in this case the vaccine, which was the HPV vaccine, not the Tdap. The event is serious and should be reported to the FDA once a patient has experienced a serious complication such as death, life-threatening, hospitalization, disability, permanent damage, congenital anomaly, or birth defects, or now requires intervention and prevent permanent impairment or damage, or other medical devices, as well as any other serious medical events. In this case, that did not happen, but adverse events can be preventable in some cases, and preventable means that they are avoidable by means currently available unless the mean was not considered a standard care of practice. Preventable adverse events are defined as care that fell below the standard expected of the healthcare provider.